General and local anesthetics. Anesthetics are drugs that depress the central nervous system. Therefore, they depress the consciousness. Most people call that going to sleep. It's not the same as sleep, but that's what the general population calls it. There's a loss of responsiveness to sensory stimulation, including pain. Now notice that says loss of stimulation. It doesn't say they don't feel it. It says but they can't respond to it. And anesthetics also result in muscle relaxation. There are two types of anesthesia. The first is general, and the second is local. Now we're going to talk about a few other minor variations, but those are the two major things we're going to talk about. Now, general anesthetics, the central nervous system is altered to produce varying degrees of pain relief, unconsciousness, skeletal muscle relaxation, and reflex reduction, also known as smooth muscle relaxation. You want that because when you put a breathing tube down your throat, you don't want them gagging. That's one of the major things you're doing this for. Why do we use general anesthesia? For surgical procedures that require deep sedation. They need to be really far down asleep for this. And it's probably going to also take several hours. It's a longer-term procedure. This general anesthesia, it can be induced quickly. There's a rapid onset. And assuming that kidneys and liver are working okay, the drugs are also quickly metabolized. So they get out of the body quickly. General anesthetics, we're talking about inhaled anesthetics, and that requires that they be intubated, a tube down their throat, so that we can very closely regulate what kind of air is going in and what's coming out. And there's also the injectable type, where that's an IV. And they put drugs through an IV to make people unconscious, and the injectable kind can be done either alone or it can be done along with the inhaled type. Now remember when I said that general anesthesia doesn't necessarily take away pain itself. So what we try and do now is called balanced anesthesia, where a combination of drugs are given to maximize the anesthetic and the analgesic effects, but also to minimize the adverse effects. So we try and balance all these drugs to get the optimum levels of sedation, pain relief, skeletal muscle relaxation, and reflex reduction. To do that, we use several classifications of drugs. We use sedatives and hypnotics. We use opioids, which are narcotics. We use neuromuscular blocking agents. Some people call them paralyzing agents. It makes it so the person can't move. And we use anticholinergics. When we look at the adverse effects of general anesthesia, it varies from drug to drug, whatever we're using, but primarily we're looking at the heart, the circulation, the liver, the kidneys, the respiratory tract. Remember, these drugs depress the central nervous system, so they're going to depress the action of the respiratory tract. They're going to depress the action of the heart. Myocardial depression is commonly seen with general anesthetics. Perhaps the most feared adverse reaction is malignant hyperthermia. It occurs during or after anesthesia. There is a sudden elevation in body temperature greater than 104 degrees Fahrenheit. Now that's not compatible with life for very long, so it requires immediate attention. There's also tachypnea, tachycardia, and muscle rigidity that goes along with it. And it is a life-threatening emergency. Local anesthetics are also called regional anesthetics, and it's just focused on one body part or region of the body. And the person is awake. There's no loss of consciousness with this. They can be administered topically through creams, lotions, whatever, but directly onto the skin or the mucous membranes. And it can be given parenterally, injected intravenously or into the central nervous system or into the spine for some of them. The spinal ones, it's injected into the spine or around the spine. In either case, it's not going into the spinal cord. It's going into the region around it, so it soaks into the cord. Infiltration is where it's in. The medication is injected around the area. That's typically what's done when you go to the dentist and have a shot to numb your mouth. There are nerve blocks where the medication is injected right next to a nerve, so it soaks into the nerve. And then there's topical, which are the creams and lotions. When we're talking the parenteral, the injectable, local anesthetics, quite often we're talking about lidocaine, and that's the drug out of today's lecture I've asked you to learn about. Why do we use local anesthetics? We can use them for relatively minor surgical, dental, and diagnostic procedures. And it can also be used for certain type of chronic pain. You use a patch or a cream or a lotion. That can be used on a long-term basis for chronic pain. Okay, moderate sedation. Some people call this conscious sedation. It's not really general anesthesia, and it's not really local anesthesia, and it's not really analgesia. It's kind of a combination of all of those. In that, patients are given both anti-anxiety drugs and narcotics. The patient is awake for the procedure, but won't remember it. One of the major benefits is it preserves the patient's ability to keep their own airway open so you don't have to intubate them, and they can respond to verbal commands. It's used for procedures that don't require deep anesthesia or long time being unconscious. And during it, a topical anesthetic can be applied as well. There's rapid recovery, and it's a much safer procedure than general anesthesia. I really kind of glossed over the risks of general anesthesia. General anesthesia has a lot of risks involved, and we don't want to go into it unless we absolutely have to. All right, nursing implications. Always assess the patient's history of surgeries and how they responded to anesthesia. You want to find out if they had a bad reaction to anesthesia in the past. That's going to guide what happens this time. As usual, you're looking at past history, allergies, medications, alcohol, what kind of drugs they used, opioids, have they eaten recently, all of that. We're looking at them before, during, and after the operation. Now, this is not an operating room nursing course. But just generally think about it. We're depressing the central nervous system. What are you going to be looking at? Hey, I'm looking at the airway. I'm looking at the breathing. I'm looking at the circulation, because they all could be depressed by the medications that were given. And once the patient has woken up, they need to be reoriented and told that where they are, what happened, what's going to happen next. They might be confused. They might not remember real well what you told them beforehand, so you may be repeating a lot of what you told them ahead of time.